About 1% of the UK population have rheumatoid arthritis, which is the most common form of inflammatory arthritis, and women are 3 times more likely to be affected than men. Although arthritis often starts for people over the age of 40, it can affect women during pregnancy, and it is important that it is well managed. In this short video, we'll explain how all types of inflammatory arthritis can affect your pregnancy, how pregnancy can affect your arthritis, and what you can expect during pregnancy and labour. It's important to remember that your midwife will support you throughout your pregnancy, but your GP or specialist will continue to manage your arthritis care. How can I prepare for pregnancy? If you're planning a pregnancy, let your GP or rheumatologist know so they can help you access the correct advice. Women with active disease may find it more difficult to conceive. Your specialist team will work with you to keep your rheumatoid arthritis under control while you're trying to get pregnant. How could my arthritis affect my pregnancy? During pregnancy, for women with disease, there is an increased chance of miscarriage, growth restriction, or when your baby does not grow as expected, or your baby being born before 37 weeks. Depending on the severity of your arthritis, you may see an anaesthetist during pregnancy to make a plan together for your birth. For some types of arthritis, you will be offered a blood test to look for antibodies, which can cause complications for the baby. If you test positive, your baby will have extra checks on their heart. If you're worried about this, you can discuss it with your midwife and specialist. How could my pregnancy affect my arthritis? About half of women will experience an improvement in symptoms during pregnancy, and for the other half, their symptoms will either get worse or stay the same. If you have rheumatoid arthritis and have positive antibodies known as seropositive, you are less likely to experience an improvement in your symptoms during pregnancy. If you flared during pregnancy, this can be managed with physiotherapy, pain relief, joint injections, steroids, and other medications. There is also an increased risk of flare for around 6 weeks following the birth of your baby. What should I do differently during pregnancy? You do not need to make many changes to how you manage your arthritis during your pregnancy. You should ensure you remain active to help keep your joints mobile and strengthen the muscles supporting your joints. Be sure to keep in contact with your specialist team and let them know if you experience any changes in your arthritis symptoms or have any questions or worries. What should I expect during my pregnancy? One of the first things that will happen is your medication will be reviewed. It is very important that arthritis is kept under control during pregnancy, and while most medications are safe in pregnancy, this needs to be individually assessed. Many biological therapies are continued for all or part of pregnancy. If you are on any of these medications, this will be discussed with you as your personal advice may vary. The vaccination schedule for your newborn may also be affected, and you may be asked to attend extra appointments and scans of the baby. It is likely that taking aspirin will be discussed with you to reduce the risk of preeclampsia. You will also be assessed for the risk of blood clots, and if you are flaring or have other risk factors, you will be offered injections to reduce this risk. The vast majority of medications can be taken while breastfeeding, but if you're unsure, speak to your GP or specialist. When should I seek help? If your arthritis is flaring, contact your midwife and specialist team looking after you. If you have concerns about your pregnancy, you should contact your midwife or maternity hospital, and if you feel unwell generally, you should call 111. To recap, if you are planning a pregnancy, let your GP or rheumatologist know. Women with active disease may find it more difficult to conceive, but your specialist team can support you. During pregnancy, there is an increased risk of miscarriage, your baby not growing as expected, your baby being born before 37 weeks. Your specialist team will work with you to help minimise these risks. Don't stop taking medications without checking with your specialist team. Flares during pregnancy can be managed with physiotherapy and medicines that are safe for you and your baby. If you are ever worried or have any questions or concerns, contact your midwife. Thank you for watching. This educational video was created by the South West Maternal Medicine Network.